The murmur of aortic insufficiency is uncommon. The first and second heart sounds occur normally, but a high-frequency diastolic murmur begins with the second heart sound. The murmur characteristically diminishes in intensity after its onset and is called a decrescendo diastolic murmur. Notice how the normal heart sound pattern is disrupted by this high-frequency diastolic murmur. Listen to the murmur of aortic insufficiency played at slow speed and then increased to a normal rate. Asynchronous closure of the left and right atrioventricular valves may produce a first heart sound that is split into two audible components. This occurs normally in the larger breeds of dogs. Note the low-frequency split first heart sound of a normal, large dog. Compare the split first heart sound in the previous band to that of a normal dog without a split first sound. The systolic click is a high-frequency sound commonly heard over the mitral valve region. It is not heard with every beat if it moves close to and then away from the first sound. This sound, unlike the split heart sounds, may occur singly or in multiples. In the dog, systolic clicks may antedate mitral insufficiency. Splitting of the second heart sound occurs when closure of one semilunar valve is delayed. Chronic lung disease and heartworm disease may produce splitting of the second heart sound if pulmonary hypertension develops and delays pulmonic valve closure. The split sound is most prominent over the pulmonic valve region along the cranial left thorax. The sound resembles that of a lub-drup rhythm. The split sounds are close together and higher in frequency than the first sound. This split second sound was recorded from a dog with heartworms.